Thank you very much, Uli, for inviting me. It's a pleasure to be here. And as was mentioned, I am the Chief Medical Officer of ConnectWell. And ConnectWell is a public-private partnership with the UC Berkeley School of Public Health that makes academically sourced, expertly vetted health information available to patients and consumers in a health literate way that's quite engaging for patients to read. And I'm going to just start out with a little story here. It's a true story that of a woman that I took care of in my practice. And she is a woman from Nigeria who's 23 years old, pregnant with HIV, so came to me for consultation and to begin antiviral therapy. And we started her on therapy, and I explained to her why she was taking therapy to prevent mother-to-child transmission of HIV. And she did very well. Her viral load went to undetectable levels, and she came back later on in the pregnancy before she was to deliver, and I drew her blood, and her viral load was sky high, and her T cells had gone down quite a bit, and I could not figure out what happened. And I spoke to her, and she said that she had stopped all of her medicine because she had read an article on the internet that said pregnant women should not be taking any medication because it could harm the baby. And so she read some information that was out of context for what her particular problem was, and that's the risk of going on the internet and being able to look up anything at any time, and we're all bombarded with information. So she made a decision that could have severely impacted the health of her child. Thankfully, we were able to get her viral load down to undetectable levels again before delivery. But that's the benefit of having good, reputable, excellent health information that's curated, and you know, we can all look up things now at any time. We've all become a bit of a Dr. Google, if you will. Even in the office, when I see a patient, if I need to answer a quick question, I'll go to Google and look up something, but I know at least where I'm looking for, right? Patients don't. They don't have that type of expertise and knowledge base of what's trusted and what's not. And it's no wonder why people are looking up so much information online all the time. 70% of chronic diseases and their associated costs are related to unhealthy lifestyle practices. That's what the CDC states. And 60% of Americans are living with one chronic health condition, and 42% of Americans are living with 2 or more chronic health conditions. So who's here looked up anything online about their own health? Everybody's fingers have to go up. I know that. Otherwise, you're just tired. So we've all done it. And in fact, it's the second most common online search next to online shopping. So if any of you are doing Amazon shopping, you're most likely to be doing shopping or looking up information for health-related information. So 80% of those searches are looked at. And there's no shortages of places where you can find health information. Everybody wants to give you health information. And some sites are more reputable than others. You'll find it in standardized and mainstream news organizations, journals, but also throwaway journals. Medical centers will be giving you information. Things in the checkout lines at the grocery store will provide you with information as well. And again, the problem is you don't know what you're getting. So physicians will have many trusted sites where they will obtain information and deliver that information to patients. Some of these include the National Library of Medicine, Medline Plus, the CDC. If any of you have ever had to give information on travelers' health to patients, we know this is a very reputable site to go. The U.S. Disease Prevention and Health Promotion Offices, the USPSTF Services Task Force, state and local health departments, organizations like the American Diabetes Association, American Heart Association, American Cancer Society, universities and medical schools. We use UpToDate in the medical centers, so it's kind of an online resource for physicians. And then medical societies like the American Academy of Pediatrics. All of these are very reputable sites, but they aren't easy for patients to navigate and look up. So we may know how to do that, but patients may not know how to do that. So when you're looking up information, some of the cautions that you need to have include sponsored sites with sponsored advertisements, sites that look fake, those sites that require payment for you to actually get the answer to what you were looking for, sites that promote quick cures, sites that offer miraculous, instant, or guaranteed outcomes, sites that offer fast weight loss, and outdated articles, especially for topics that are rapidly changing like cancer therapies. We have many therapies that are coming up to be the standard of care, and if you look at when an article was written, if it's 2 or 3 years old, things could have changed. So I'm just going to give us a little example here of what it looks like when you go to Google and you type in a very common search like back pain, a real common primary care medical problem. When you hit and put in back pain into Google, what you will see here is that there are about 1.6 billion hits that come up right away, and there are a number of different sites that you'll see, locations where you can get your care, and many of these include advertisements, and even Amazon has sites here that you can find. But I'm going to click on WebMD, and a very common place where people go to, and here's information on Back Pain Health Center. If you begin to click more, you may or may not find what it is that you were looking for. You're often bombarded by advertisements, and some of these advertisements are very esoteric, and you will go and find information on ankylosing spondylitis and whether you need Humira or not, things that had nothing to do with what it was that you were really looking for to begin with, right? And so there's 1.6 billion sites that you could have chosen here. And so the average patient has no idea what to choose from. And so I'm an advocate for a patient-centered and curated site, that which is coming out of Berkeley. Berkeley's been it's been a pioneer of wellness and education here for 40 years. They have a science-based, expertly vetted, and current, with no advertising system here. You get with what you're looking for. You get an in-depth and wide-ranging coverage of health conditions and wellness practices. And the articles that you read are short and health literate. All of the information that comes out of them have been actually run through systems so that you can target the average reading audience here in the United States, which is about sixth grade level. Anytime you have something a bit greater, it's because it includes technical terms, and so then those terms are inspired, explained. The Berkeley site actually is divided into 3 parts: a health and wellness digital library, wellness initiatives, and healthy recipe collection and nutrition. And I'm just going to show you quickly what a demonstration of back pain would look like on the site here at Berkeley's. So you go to the Health and Digital Wellness Library. You can actually type in within a search bar or go to an icon that shows the back. There are 45 different articles that show up here on back pain, and you can find the one that is most specific to what it is that you were looking for. Here's causes of back pain, and you'll find a nice article that's easy to read, not too dense. And then there are related articles that you can then choose for your next sequential topic that you would like to read on: diagnosing back pain, what it is that you would expect your doctor to do in an examination, and then a further article is, do you need any imaging for back pain, and explains that as well. You can print these things out, and the nice thing about this entire program is that there is an API behind all of this, and so this service through Berkeley can be integrated into a telehealth program, an insurance program, anything that's being run now on these advanced platforms. So some of the customers that we work with are healthcare providers, systems and plans, as I mentioned, telemedicine, health device companies, employers and health benefits providers, any company that needs medical content. And the integration options are quite easy with this API here. And our revenue model is an advanced content license, or an annual content license agreement. So for any additional information, you can go to our website, connectwell.health. Again, UC Berkeley is the School of Public Health associated with UC San Francisco, and or you can email info@connectwell.health. Thank you.
Thank you very much, Michael.